Good morning, everybody. I don't want to use the patient's name here, but I just want to review the great result and show you the tiny bit more that we need. So I believe this has been going on for 15 months, and it's been so efficient compared to what braces would be. You can see here we had a lot of crowding in the front, and now you see how nicely these are aligned. If you look very closely, the teeth that were originally out on the sides here still have a little bit of that. So when I click here, you see how we tuck that in. So this is going to make the alignment a little more perfect. I think I actually have to move this in just a little bit. So I'll tweak this, but it looks like we're only going to need 3 to 4 more active aligners. Then I'm going to make some aligners that are passive that will be worn for actually a few months at night before we make the retainer. So that's the upper. And then the lower is looking fantastic. Now, the reason why I say this is more efficient than braces had nothing to do. When I use the term efficient, I'm specifically talking not about the comfort or the invisibility, the lack of emergencies. I'm talking about the time of treatment. Here's what people do not really understand. If this case had braces, and I can tell you I have treated this type of case, a misalignment of the front teeth case, as you see in the beginning, with braces, the teeth indeed would get straighter faster with braces, straighter faster. But the braces are placed by eye and by hand by orthodontists like myself. And therefore, the alignment still needs to be adjusted because we're not robots. And also, what would happen is the upper teeth would actually come out too much in the beginning, and then the orthodontist would have to work to bring them in. Braces are harder to control. The Invisalign has been all planned, and the movements are sort of confined by the aligner. And so, while it may seem like a gradual process, and while we may have to do 1 or 2 rounds of aligners, which seems like we might be starting all over, we end up in what will be this great alignment that you see right here in less time in most cases. And I think you know this, but if you ask some of your friends who have kids with braces, the vast majority will have them on for 2 years. That's what orthodontists allot themselves. That's how payment plans are set up. It's not a progressive system. It's archaic. It's the same braces as it was 30 years ago. But here, we can treat things cleaner, more hygienic, and more efficient without even charging additional fees. I hope you enjoy looking at this, and we'll see our patient in the next couple weeks.